Hi guys, so just want to talk about infection control. So many things to kind of cover, but I'm just going to start just like I did with some of my other videos, just off the cuff and just, I guess, talk about the most important key points of the dental practice. And all of the infection control routines and systems should all be embedded into a daily and a weekly and a monthly checklist. So none of this should be new, and it should all form part of the induction training for all staff, whether it's the staff training videos, all practices. We're going to start making, online training portals for all new staff to go on, watch all the videos. So when they come in, we have a little Q&A. They've done their blood tests, they've done all their contracts and their super fund and their employment details, and they know their award rate. This should all form part of the induction checklist anyway, which we've got now for all of our clinics too. Everything's systemized, everything's covered, all in line with the current guidelines. So, look, let's start from the top with infection control. Starting with the sterilization area, which is probably, the most important area of the practice, and having really good, the whole layout of the steri room should be, contaminated zone, moving around to a clean. It should form a very one-directional process that makes sense. No cuts or corners or grooves or anything where kind of debris can build up. You should have a soak basin where, materials can soak, instruments and that can soak. No handpieces to be soaked. At the point of use for any dental instrument, whether it's using composite or blood, should always be soaked and cleaned off immediately, whether it's bond or cement, because the longer you leave it, the harder it is to clean off. But after you've soaked it, and then you put it into the ultrasonic washer, once again, you don't soak any of the handpieces, you oil them, and, after you've cleaned the ultrasonic and you've put the detergent in there and you've degassed the machine every day, then you dry it on we've got microfiber cloths. We inspect it closely, all the instruments closely under the light, make sure there's no debris in the beaks or anything like that. Dry the instruments thoroughly. All the critical instruments have to be packaged with the name of the instrument, load number, tracking number, cycle number, and date. And they should be packaged up into sealed sterilizer pouches with indicators on them. So before it's sterilized, it should be pink. Afterwards, it should go into go black. And when you're loading things into the sterilizer, always put the plastic side down, paper side up. Never overcrowd things in the sterilizer. Now, the first cycle of the day is always a Bowie-Dick test. Now, you can actually put instruments in on the Bowie-Dick test, because if it passes, then the instruments, that they're sterile anyway. You should always be tracking each cycle, whether it's digitally or you can track it on the form. And what has it got? Just off the top of my head, you've got like date, load number, which autoclave it was, what instruments were in there, were they loose, were they wrapped, did the chemical indicator change? And on the chemical indicator printout of the sterilizer, you should always circle the parameters to show that you've checked that it's been at 4 minutes at 134 degrees at the pressure that's required to sterilize the instruments. And what that means is that any kind of bacterial spores or anything there have been sufficient enough to remove and kill any kind of living organism, preventing cross-infection. So after the autoclave's done, you take them out, you let them dry, so you don't want to hurt yourself. You use a fork or something that you take the trays off, let them dry and put everything back. Now where you put all the instruments, any kind of loose instruments should ideally have a lid over them so that there are no aerosols or dust or gas build up on them. Any kind of sterilization pouches or anything like that, if you drop them and they're punctured, you have to put them through. We have to have systems for the practice. If you drop an instrument, everyone knows, you bring it off to the side and you always reprocess it. You should move it off to the side with your foot or something like that. Keep working on your procedure. Always checking for the burrs and everything, making sure there's no rust, they're not worn out. If they do, you dispose of them. In terms of sharp instruments, you throw out matrices After you use them, you throw out wedges. Obviously, the clinician throws out the sharps, throws out the needles in the easy to access sharps bin. What I always do as well with biological waste, amalgam stuff like that, if you're taking out a tooth, you can actually put them in the sharps container as well if it's close by. Um, yeah, so I mean, going into the steri rooms, you should, into the treatment rooms, you should be ideally purging the lines between every patient. A couple of minutes at the end of the day and 30 seconds between patients purging water out of the lines. You can feed I feed in my practice little silver antimicrobial tablets just to help flush the line, to just keep them in there. I think about once a year you should probably do a spore test as well, bacterial test of the lines, just to make sure there's no bacteria growing in the lines. In terms of the clinical rooms, any kind of grooves or anything like that you touch should ideally be closed over with a barrier. But, we try and minimize any overuse of barriers. If it's a smooth surface, you don't really need barriers. Reduces, environmental wastage, minimizes overspending and stuff like that. But, to the dental nurses, anything the dentist touches, you should always be wiping over with an antiseptic wipe. In each of the treatment rooms and in the steri room, there should always be a don't call it a dirty zone, contaminated zone, and there's a clean zone as well. And then if you're going to work between the two, you can consider having some transfer tweezers. If you are using sharps and stuff like that, you could have a kidney dish as well, just to kind of sit instruments there. And yeah, the aerosol zone is usually around 1.5 meters around where the patient's head is. So when you're putting the handpieces up on the seat, make sure the hand burrs are sitting in to minimize risk of sharps injury. When you're cleaning the chairs, and when you're cleaning the room after a patient, and you're ready to wipe the room down, you've taken out all the instruments back to the steri room, ideally using a transfer tub with a lid on it, so that if you don't drop it, you don't drop instruments everywhere. The order that you wipe the room down is from the least clean to the most dirty. So you'd start with the chair, and then you'd probably you start maybe the clean zone, and then the chair, and then say, the contaminated zone, and then the handpiece area, maybe a couple. You'd spread it out over a couple of wipes or something like that. But yeah, I mean, look, ideally, you obviously look to minimize wastage, but it's getting it all in the right order. Yeah, what are some other things as well? Hand hygiene as well. So know your PPE, the order of which you put your PPE on. You know the order in which you put your gloves, your eyewear, and your mask on as well. It's important. Know your 5 moments of hand hygiene as well. That should always come as part of your onboarding process with the practice. After lunch, always wash your hands, or after going to the toilet, wash your hands, and then you can use just between after you deglove and stuff, always using an antimicrobial, alcohol or chlorhexidine based hand rub. Okay. And when you're washing your hands, always washing right up around the wrists and everything like that. All like this back here. Nails should always be short. I'd prefer you to always just be really well groomed in the clinic, even though you can have facial hair. It's always nice to just look professional. Any kind of scrubs or anything like that, don't wear them outside the clinic. Just keep them in the clinic. The washing of the staff uniforms and scrubs should be done by medical grade, either a cleaner or, some does medical grade, and kind of medical grade washer or something like that. When you're processing the x-rays, having good infection control there, it's touching patient's saliva, so you got to make sure that, possibly dry it with saliva, use a bit of antiseptic, take it off and then put it in there. Sometimes you might need an extra assistant for that. Sometimes you might need to call the assistant in the room, or an extra assistant while one nurse is retracting or something like that. You need an extra nurse to come and help things out. So calling out, or even using a little buzzer or a bell or a little ding or something like that. can be quite useful. Saves having to yell over the practice. Yeah, so, making sure the place is always hotel clean. The waiting room, the seats. Another thing I like to have to do as well is having patients have the ability to sit at the reception when they're paying their bill. You don't want a patient standing up and you're sitting down while they're paying the bill because there's a power imbalance. Take a seat, make yourself comfortable, especially if they've had an extraction. They might feel a bit lightheaded or stuff like that. Um, you know, it's always nice to just have them seated during that process because they could be there for 5-10 minutes. They might have some more questions or stuff like that. So it's a bit of a personal note which I need to implement to these practices as well. Just kind of thinking off the top of my head at the moment as well. So yeah, always watch anything the kind of dentist touches. You're going to have to use antiseptic. Always making sure the EMSs are full. There's enough water. Making sure the handpiece bottles are full. If there's any amalgam that you have to remove, depending on the clinical stuff like that, has to be removed by a waste company that specialises in that kind of stuff, depending on what kind of suction system you use. Autoclaves should be maintained and every 12 months, and they have to be validated every so often as well. So even though the autoclave company usually reaches out to you, it's still your responsibility to follow up on these. It's always the dentist's responsibility for the infection control within the practice. Even if it's not the owner there, the dentists working in the practice are also responsible for infection control. Always put the tracking numbers into the patient's file as well for any critical instruments. Okay, you actually don't need to do it for non-critical instruments. But if you still want to bag everything, you can do it. I think it's personally wasteful. As long as all the containers or everything are lidded and only clean stuff obviously entered in there, and every so often dust is cleaned out, every say month or couple of months, instruments taken out, dust is removed from there, and then it's popped back in. Too much wrapping and baggage can be a bit cumbersome. It's not just expensive, but it's just time consuming. And sometimes you might see a patient, you might only just need a mirror. It might just be a review. You don't need like a whole packet thing out, but you can if you want. So yeah, I mean, look, critical instruments, any instrument that goes below the gingiva, that and that includes deep periodontal probing, hand scalers for deep periodontal scaling, obviously extraction instruments, surgical handpieces, and intraoral mirrors as well. Make sure you don't scratch them after you use them. Wrap them up in a non-scratch. You can use a microfiber lint with a bit of masking tape on it. After put some antiseptic and put that through the steri. Make sure there's no, and same with the dental mirrors as well, easily scratchable. Watch out for that. And if you are using pumice for the cleanings, don't rub, use the mirror to retract and there's pumice everywhere. It just scratches the whole mirror. Use the other end of the mirror, the tail end. And when you're taking instruments out, it should be standard routine. You should always be looking at the color of the package before you use it and you unwrap it. It should be color black. If it's pink, it hasn't been sterilized. Even if it's sterile instruments, you put them in a bag. But it hasn't been, sterile instrument, you take it out and you put it in a pink bag, say that's clean. Well, technically it's not. You should assume that anything pink is contaminated. Don't use the word dirty because patients hear the word dirty and their perception is, oh, it's dirty. Also, when you're putting the glasses on the patient after, you obviously use antiseptic wipe. Sometimes it's quite often that there's smudge marks. Give them a good rub with a tissue, and if they are scratchy, let them know scratchy, or if they are blotchy. Sometimes patients think it's dirty, not a good look. So you always look, sorry, the patient, the glasses are a bit blotchy. It's from the antiseptic wipe. Sorry, the chair's a bit wet. It's from the antiseptic wipe. We've just sterilised the room. They understand those words. You shouldn't have to start we use the best infection control. It's assumed. I'm a really ethical. It's assumed. I'm going to do such a good job for you. It's assumed. You can really trust me. That's assumed. You don't need to say that stuff. Remember, they walk into the practice. You don't have to build their trust. They already trust you. Don't give them a reason not to trust you. And they should trust you. And they don't even have to trust you. They can verify it for themselves. Especially with examinations, like showing a patient what's wrong with their teeth, letting them do the examination. Remember that you're helping them with their problem in their tooth. And you're the fiduciary advisor that's going to help them with their problem. And if they don't want help with their problem, it's their problem. You're not emotionally invested. You're still going home at 4 p.m. anyway. You're not going to be thinking about them when you're leaving work. So let them make the call. If you do shake a patient's hand, don't rub hand hygiene straight afterwards. Because it looks like you're going, that patient, like that. They might get a bit offended and a bit embarrassed. Just also as a side note, when patients say, I'm really embarrassed, it's a real mess in there, say, look, it's nothing I haven't seen before. I've got thousands of patients. I've seen everything from A to Z. They say, I'm going to get all this work done later, all this stuff. Say, look, you're here now, let's deal with your issue, and we'll just take it from there, okay? Nothing I haven't seen before. So I haven't brushed my teeth today. That's all good. Really minimize any abrasivity with the patient. Most of the time people are embarrassed when they come in, so don't lecture them, don't make them feel embarrassed, don't belittle them in front of the other staff. If it's a sensitive topic, like you're talking man to man, you're talking about, or something like that, or, blokes when they got their girls there, they can get embarrassed about the money situation. Don't embarrass them in front of, in front of their girlfriend. Men, if the man's, which typically are a provider, don't embarrass them about the money, especially if it's like a new girlfriend. If it's a husband or wife, different story. But, if you're taking photos and stuff and you're showing photos on the screen and there's someone there that might be a potential mating partner, don't embarrass them in front of that mating partner or anything like that. So I said, do you mind? Do you mind? Do you mind if I just have a moment in private, please? And don't hesitate to ask the nurse to leave the room either. Do you mind just giving us a moment there, please? Just have something, just like to have a chat about. And man, they respect it so much. They respect it a lot because it shows that don't embarrass people. It's same with when you're giving feedback to your staff. Can I just have a talk to you in private for a second? And talk in private. Don't embarrass people in front of others. It's the quickest way to make an enemy, and they'll never forget it. If someone's done something wrong and you've got some feedback or you want to talk about something, don't embarrass people, please. It is the quickest way to create a negative and toxic bullying culture in the workplace. Most of the time people are aware they've done something wrong anyway, and you don't even need to tell them. So just be careful about lowering other people's statuses. And it's not always intentional. It's not always intentional. Sometimes you're busy and you get frustrated or something like that and you just kind of say it. But just try to be aware of people's emotions. And if things are going wrong within the surgery or someone, something, don't let the patient know. Don't use negative words. Always use positive words. Let's say burr gets dropped. Let's say, the burrs have dropped. Don't use those sounds and everything like that. Can you pass me another burr, please? Fantastic. That's great. Stay calm. Stay emotionally calm. Stay tough. You're a swan. You're paddling furiously underneath the water, but you look very calm and graceful above it. Maintain that elegance. Maintain that smoothness. And when you're handing things to each other, don't hand them right over the patient's face. I'll come to that in a second. Hand it around here or around there. And if a patient comes in with low cut top, always put a bib on. And sometimes patients say, I don't need glasses. Say, if you're just getting a mirror and you're inspecting a extraction socket, it's fine. If you've got instruments and stuff passing over the patient's face, they can wear their own sunnies if they want. But most of the time they'll prefer it. A lot of the times they've got their own sunnies, especially the tradies. But why do I have to wear safety glasses? It's just to protect your eyes. Do you mind wearing those safety glasses? I just want you to wear them, please, just to keep your eyes protected. No one wants an instrument dropped in their eyeball. You certainly don't. And especially with impression materials as well. Now, I've never done it, touch wood, but even when you're taking impressions, especially PVS and stuff, make sure they're wearing eyewear. Imagine dropping a bit of PVS in someone's eye. You don't even want to think about it. And same with hypochlorite as well, especially if they're wearing nice clothing. Make sure they're covered up. If you've got like a little apron or something like that that goes underneath the bib, that's always a nice touch too, because you don't really want to spill any hypochlorite on any particularly black clothing, because it's like bleach and it will cause the marks to go white. You don't want to have to pay them for new clothing. And always give them a chance when they leave the surgery. Always make sure their whole face is cleaned up. Don't leave any stuff over their face. Give them a chance, and if they've missed a bit, let them go to the mirror. Let them give them a chance to freshen themselves up. Give them a nice rinse after impression. Bit of gooey stuff here. It's all good. You just stay nice and relaxed. We'll give you a rinse up. Bit of messy stuff. Give them tissues straight away. Then take them off and give them some more tissues. And pop a little bit in there and let them take it. And then after you finish, you bring them up for a nice rinse. And then you tell it's just silicone. It's just silicone-based material. It's not harmful. Patient's got things in their mouth with a yucky taste. Tell them it's safe to swallow. Bit of a funny taste there. That's a yucky taste. Yeah, it is. Oh, that dentistry is expensive. Yeah, it is. Don't be abrasive to them. Understand. Yeah, it is. That was painful. Yeah, it is a bit sore. Yeah, it is. Yeah, it is. But you tell them all this stuff before, so it's never a surprise. You're always anticipating any problems before you do anything. And you tell the patient, Good communication, pristine communication, strong empathy skills. This is the difference between a good dental practice and a great dental practice. Hope you enjoyed this. I'll talk to you soon.